Colorectal cancer is killing more and more younger men and women, and doctors are still trying to figure out why. Now, currently, overall cancer deaths are falling in the U.S., but just this week, the American Cancer Society reported for the first time colon and rectal cancers have become leading causes of cancer death in younger adults. Look at the data. In 1995, 11% of new diagnoses of these cancers were in people under 55. That has since risen to 20% in 2019, and that means it's gone from 1 in 10 diagnoses being a young person to 1 in 5. So the question is why? And we are bringing in Dr. Ross Buerlein, a gastroenterologist and assistant professor of medicine at the University of Virginia. Doctor, welcome. And I have to say, I was surprised by these stats. Colorectal cancer now the deadliest cancer for men under 50, the second deadliest for women in that age group, and that's only behind breast cancer. So the question is why? Why are younger adults getting this disease?
My name is Asha. Thanks so much for having me, for highlighting this really important topic. That's a great question. It's one we really wish we had a definitive answer for. There's really no one single answer for this. It's a multifactorial problem, meaning there are lots of different reasons for it. We know that obesity plays a role, and we've got rising obesity levels in this nation. We live sedentary lifestyles. We eat more processed foods. Perhaps there are issues related to the gut microbiome, which are the bacteria that naturally live in the colon. And there are many other different hypotheses that are out there, and it's likely a multifactorial process, but one that we're definitely working to better understand.
Do you know what I think is incredibly frustrating? And it's something I've heard from my own friends a lot as well. According to the Colorectal Cancer Alliance, 75% of young colorectal cancer patients visited at least 2 different doctors before getting diagnosed, with 40% saying symptoms and concerns were missed by their doctors. What do people need to know about this? What do people need to do or advocate for themselves in order to stay safe?
Yeah, you need to look out for signs and symptoms of colorectal cancer. Those are going to be things like blood in the stool or anemia that's otherwise unexplained, particularly iron deficiency anemia, which can show itself as fatigue, weakness, shortness of breath. You can have new change in bowel habits, abdominal pain, unexplained weight loss. And you've really got to advocate for yourself. And these are topics, especially changes in stool or blood in your stool, that people don't really like to talk about, or they may feel uncomfortable sharing that with other people. But it's really important that you look out for those things. And you've also got to know your family history. If you've got a family history of colon cancer or rectal cancer in a first-degree relative, so a mother, father, brother, sister, your risks are even higher. So you got to advocate for yourself. And if you're 45 or over, you really got to get screened if you're in the general population. And if you do have that family history, you might need to start your screening earlier.
Yeah, the recommended age to start screening, as you mentioned, for colonoscopies is now 45. That's brought down from what it was at 50. Is that enough? Should people be starting earlier? And is the concern, if they don't have that first-degree relation, a mother or parent who has a history of colon cancer, will their insurance even cover it if they go in at 35 and say, hey, doctor, I really want this?
That's exactly right. Yeah, and the answer is probably, unfortunately, it won't cover it at an earlier age. But this is a big step to move from 50 to 45. We've now opened that up to many more patients to begin screening. And if again, you got to look out for those warning signs. We think that risk is lower in people younger than age 45, but that's data that's still coming in and is still being studied. And there's certainly a chance that in the future that age could be lowered, even lower, from 45.
All right, Dr. Ross Buerlein, I appreciate your time tonight. Thank you so much. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.